Hi, everybody.
Welcome back.
Welcome back to Wellness Wednesdays
Wellness Wednesday.
with Dr. Annie
Dr. Rachel.
of Rise Wellness Chiropractic.
Yep.
We're both like repping our gear today too.
Mm-hmm. Not even on
the back?
purpose. Oh yeah, we do
Yep.
that.
We both have
Mine on.
our
Yeah.
hoodies on. Yep.
Awesome.
Feeling cool that we didn't plan that either. It just happened.
Okay, so today we're going to talk about just chiropractic in general. We're going to start from the very beginning.
What is chiropractic?
What is chiropractic? Why
Yeah.
should anyone go to a chiropractor?
Mhm.
What is this witchcraft we do? So, go.
Yeah. All right. We have a little spine here. Some people wonder why chiropractic. I know I always wondered why chiropractors had so many spine models like in their offices and stuff because I thought it was really tacky before I became a chiropractor. And I was like, I get it. I get why everyone loves the spine so much because it's pretty freaking cool.
But also, you need it to show people.
But
It's hard
you
to
literally
explain.
need a model to show people, why.
Explain what chiropractic is.
Exactly. So this is a little tiny model of what our spines look like in our bodies.
How many bones are there? Do you know? Do you remember?
God,
It's 33. Isn't it
33?
33?
There's 33
Principles of
chiropractic. It depends on what stage you're
7,
in.
12, 5.
Yep. But then there's also like the
The
sacral
sacrum.
sound. So it depends on like how many you're counting. Really.
Okay, right.
Sometimes these ones don't fuse, so then you get extras. You got a skull up here, pelvic bones. Depends on like if we're counting just.
Right.
Right. Okay. So we're getting off topic.
Okay.
Okay. So our spine is made up of some number.
Kevin, quick, do the addition.
Of vertebrae is what they're called. That's what these little bones in the spine are called. So what chiropractors look for is to see if any of these vertebrae are out of place. But the point of the structure of our spine, of it being made up of these little tiny bones, is to protect our central nervous system, which is the most important system in our body. That's how our brain controls and coordinates everything that goes on in our body. So brain sits up here in the skull. As you can see, we strategically sat here, also in front of our nervous system chart. So our brain is up here, and it goes down this spinal cord. So messages come down here, and then they exit through nerve roots that come out in between each one of these vertebrae. And then these branch out and go all over the
33.
place.
I was right. Born with 33, fused to 24.
Yeah.
Yeah.
Born with 33 fused.
33 principles, probably because
33 segments.
33
That's,
segments of spine.
oh my gosh. We're connecting so many dots right now.
What was that again?
Stevenson?
Stevenson.
Yeah.
He knew what he was
33
doing.
principles.
Okay.
Okay, so.
Start over. Okay, wait, quick recap. Spine encases the central nervous system, really important, controls everything, master system of the body. We like to say we're nervous system doctors, not bone doctors.
We especially like to say that.
We measure the nervous system. Brain sits up here, sends messages down the spinal cord. All spinal nerves go everywhere in the body. Muscles, cells, organs, tissues, controlling everything.
Everything.
Nothing's going to work if your central nervous system isn't
right,
working.
exactly. And so these nerves are like grouped too. So like a lot of the ones in the top of the spine, first 3 segments, do a lot of like feedback into the brain, controlling muscles of the face, jaw, all that kind of stuff.
Important
yeah.
because as a baby, latching,
Yes. Latching,
irritations, ear infections,
Yeah.
cranial nerves going through there,
Oh yeah.
vagus nerve. We should do a whole class on vagus.
We'll do a class on Vegas.
Next
you guys
one.
will hear all about
Yeah.
Vegas nerve. So then lower neck and like kind of top of the shoulders controls pretty much all of like your shoulder muscles going down into your arms and hands. So numbness, tingling, carpal tunnel, that kind of stuff.
Yep.
We see a lot of as far as symptoms go. Upper thoracics control a lot of like our upper digestive organs too. Lower thoracics and upper lumbar is a lot of like lower GI, but also like reproductive organs too. So that's why it's important, especially that like we see a lot of pregnant women.
Yeah.
And so during labor, that's coordinating with the brain, like when the uterus should contract and stuff like that too. A lot of that communication goes through that loop.
Trying to get pregnant, things aren't communicating well, might have an issue.
And then also like in the sacrum and stuff, these are a lot of nerves that also innervate a lot of those reproductive organs, pelvic floor, and then also like down the legs.
And digestive.
And digestive, yes, exactly. So it all controls pretty much everything. It's pretty great. So
the nervous system controls and coordinates all organs and structures of the human body.
Here, I'm gonna turn the camera.
We really planned this room correctly.
Look at that.
We didn't think that far
Right
ahead.
on the wall. I don't know if anyone can read it because it might be backwards in the camera.
So yeah, that's why one reason why chiropractic is important, because why would communication be off?
Right. Okay. Oh yeah. So
that's how the body works, right?
Yep. That's
I always give the example of, you eat a meal, brain's gonna send a message down to the nerve that goes to the stomach to release some acid, pepsin, HCl, whatever. Digest that food. No interference. Body does what it's supposed to do. We digest our food. Sends a message back up the brain. We don't think about it at all.
Right.
Same with like how fast our heart needs to beat or how often we need to breathe and just all the things. We're never thinking about
everything.
Everything. It's controlling everything.
And that's how it works in like a perfect environment and a perfect situation.
Right.
But the issue is we live in a stressful world and we live in not perfect situations, and that causes subluxations. So there's 3 things that we say cause subluxations. So there's thoughts, which is like our stress, how
Emotional. We all have a lot of emotional stressors, mental health issues right now.
This year too, especially, a lot of people have had a lot of like background stress, just kind of, even if we don't like feel stress from day to day, there's just a lot going on in the world right now, and a lot of people are kind of taking that into their bodies.
We'll talk about scans another day.
Okay.
So, I've got kind of story, but
so thoughts, trauma, so that's what we think of like with car accidents, falling down the stairs, falling off a chair.
I had a patient fall off a chair. That was really sad.
So bad.
Yeah, really bad. But also like repetitive motion. Like sitting at a desk all day.
Working,
if you're driving.
Yeah.
So if you're working in a factory doing the same thing, those are kind of physical stresses.
Yeah, they're called microtraumas.
Yeah.
And then toxins is the other one. So what we're putting into our body. This is the air we breathe, the food we digest, or not digest if we don't have good digestive enzymes, that kind of stuff.
Yeah.
And what we're exposed to just on a day-to-day basis. So those are the 3 causes of subluxation. The way that we describe subluxation is as a misalignment of the vertebrae that causes inflammation. It's going to break down communication between the brain and the body, but it's really actually like a lot more complicated than that too. And it really affects how communication is happening between the brain and the body, and how well your brain is able to coordinate those normal functions that should be easy. So
we can have this long before symptoms start showing up.
Oh yeah, this can be something that happens.
That's why people get checked for wellness.
Yes,
right?
Exactly. And it's something that we want to keep up on too, because we're under stress, like constantly. So that's one reason why chiropractors want you to come for the rest of your life, because you're going to have a spine for the rest of your life. Same reason why dentists want you to come for as long as you have teeth.
Yep. I think you could probably see a dentist without teeth. Gum health. Yeah,
gum health is super. We're not dentists. We're selling dental work right now. But so that's one of the important things. So we want to make sure that your brain is able to coordinate and communicate everything in your body.
Yeah.
And
your kiddos.
Yeah, everybody. Some people will say like, well, I don't have pain. Why? Like, wouldn't I know if I was subluxated? And the answer is there are a lot of functional things that can show up symptom-wise before pain ever does. There's also a lot of, like, we are really good at adapting, so our body will create a subluxation to protect an area of our spine, but then our brain is also, like, still trying to coordinate and adapt and get through challenges in our life. So we're really good at adapting until we go to pick up that laundry basket and throw out our back, right? Like, that's a normal activity.
Brush your hair, throw out your neck. I did that this morning. It even happens. But I hadn't been checked recently. It happened to me.
Yep.
Yeah. So, but these can cause pain.
They can.
That usually means it's probably been going on a while, though.
Yeah, exactly. Pain's not a super reliable symptom.
Or even of where something's happening.
Right, exactly. And so that's why we also do a full exam. That's why we check to see where you're subluxated. That's It's why we do nervous system scans to see where communication is breaking down in your body. That's why we check every single time somebody comes in to get adjusted. We're doing leg checks, we're doing other checks to like see where they need to be adjusted that day too.
Yeah.
I have so many patients when they're on the table are like, oh, I didn't even realize that hurt, or I didn't even like tell you that my shoulder was bothering me, but you found it. And that's because I'm looking for that. Like, I'm looking for where your body's telling me to adjust.
Yeah.
So
this is also kind of why chiropractic can help with immune system.
Yeah.
Because the nervous system
controls all. Yeah.
Nervous system controls all.
Nervous system is how your body is adapting to the environment. So whatever our environment is, so whether that's if we're around a bunch of sick people, our body's going to take in that information and it's going to respond to it the best it knows how. So,
should we talk about parasympathetic, sympathetic? Or should we do that next week?
yeah, let's talk about that next. Let's talk about that with Vegas.
Talk about that with Vegas.
Yeah, so cliffhanger.
Cliffhanger, everybody.
You'll have to tune in next
Everybody
week.
watching.
And we will talk about vagus nerve, sympathetic versus parasympathetic.
Yeah.
And then maybe the week after that we'll talk about scans.
Scans, how we, like, why we scan, what we use scans for, what are scans
What
do,
they tell us.
like what they tell us about how your nervous system is functioning.
Mhm.
Because, like, structure, yes, is important. We kind of talked about, there are curves of your spine that are important, right?
Mhm.
And how they develop in kiddos.
Yeah.
That's all really important. But taking x-ray doesn't necessarily tell us how well your body's functioning.
Yeah.
And we want to know.
And we want to know that it's changing too.
Yeah, we want to know how well your body's functioning, how well your brain's communicating, what your nervous system's doing, and then, like, yeah, what changes are we seeing
Yep.
as you go through care.
Exactly.
Woo! Next week sounds exciting.
I think we skipped like what we do about the. So we adjust subluxation.
Oh, okay, yeah. Right, okay.
Yeah, I kind of forgot about that.
You-
How do
You
we
get
fix it?
Yeah, you get subluxated. How do we fix it?
We do scans. We see where you need to be adjusted.
Mm-hmm.
What we're doing with the adjustment is it is kind of putting that bone back into place, which is kind of like the very simplistic idea of it.
Mm-hmm.
But what it's really doing is it's sending a whole bunch of information to your brain. So what that adjustment does is sends a bunch of proprioception, mechanoreception from all those like muscles and all the feedback that's happening in that joint that it's not getting feedback from because it's subluxated. So,
Yeah, it sends disruption.
yes, exactly.
As Dr. Tony likes to say, Metallica noise back to your brain.
Yes.
That's what I say. Like, if it's subluxated, that nerve isn't communicating well, the brain's just getting, like, Metallica.
Yeah, so it's not getting good coordinated information.
So, not getting that good,
Vivaldi,
sure.
Mozart.
Mozart music. Proprioception.
Pick your classical,
Yeah, nerves that fire together, wire together.
Yeah.
That's
plasticity. We can talk about that one week too. But yeah, so all of that input is helping your brain reorganize your nervous system, and that's why we also say each adjustment builds off the one previous to, because each adjustment your body is learning something new about its environment and also being able to better coordinate that information.
That's why we make a care plan.
That's why one adjustment is great, and sometimes people feel great after one adjustment, but our body is plastic and it can go, like it
Can change.
It changes, but it
Environment's
also,
different.
but again, we're also under chronic stress.
Yeah.
So
It's conclusion. We all have a lot of stress.
we all have spines.
We all have spines. Stress causes subluxation.
We have nervous systems.
Whether it's mental, physical, or toxic.
Yeah.
Toxins.
Yeah,
we all
toxic.
we all have nervous systems. We all have spines. Stresses. Nervous system controls everything.
Which means we probably all have subluxations.
Yeah.
Which means we all need a chiropractor. We all need to be adjusted.
So even if you don't like us, go find a different chiropractor.
We'll help you find one.
Yeah,
unless you really don't like us and don't want to ask us about it.
Yeah,
but
I just hope someone else find a different chiropractor that day.
Yeah.
Not a patient of ours, someone else.
we don't have big egos.
No.
We'll help you find somebody
No, we just want
that you
everyone
jive with.
feel good.
Yep.
Good brain-body connections. Better for everybody.
Mm-hmm.
We all feel better.
We all feel
Function better.
So this has been a wellness.
This has been a Wellness Wednesday episode. Thank you for joining. Next week is about Vegas.
Yep. What happens in Vegas stays in Vegas.
We were supposed to be in
Doesn't-
Vegas in November.
Oh, you're right. Yep.
Shucks.
More about that next week.
Yeah. Thank you.
We'll tell you the story.
Any questions, please let us know.
Yeah, thoughts, comments, concerns, drop them in the comments below. And any topics that you want us to cover, again.
Yeah. Otherwise, we got an order. Otherwise, you're going to get something like this again.
Yeah, we're just going to get slap happier as we go.